Okay, we're live on Facebook. The doctor is in. I am here today with kind of a little shaky internet capability today, but I'm here with one of our favorite interns. I think I've known her since she was 5, Sydney Pirro. And we're going to talk. Okay, we're live on Facebook. The doctor is in. Our pink table talk today. Favorite interns. I think I've known her since she was, and it's acting crazy. There we go. With Sydney Pirro, and she's here with her mom, her grandma, and her mom's best friend. I'm going to let her introduce them. But today we're going to do our pink table talk, which is basically our way of talking to women 3 generations. So thank you so much for joining us to talk about breast health. So Sid, how long have you been an intern? Like over a year? How long?
Yeah, about a year and some change. It's been a minute, so it's been good.
I know our internship is usually 10 weeks, but she's our intern that will never go away and we'll never let her go away.
Right, I'm happy to stay.
She is an amazing student at Howard University. And all right, so Sid, this is your show. We want to talk about your family and introduce your family to us, would you?
Right. So in the green shirt, I have my mom, Tamika Pirro. And then the floral, that's my grandmother, Carolyn Tate. And then we have Miss Melissa, which is my mom's friend. So yeah, that's everybody. That's the crew today.
That's the crew today. So let's talk about this because, we normally talk to people and families who have breast cancer, have a breast cancer story, and too many Black women have a breast cancer story. So I know Miss Melissa has one, so she can share her family story. But we're finding that the data is now showing that Black women under 30, young women under 30, get breast cancer at 4 times the rate of white women. Black women under 35 get breast cancer at twice the rate of white women, die at 3 times the rate. Black women under 50 die at twice the rate of white women. So we're getting it younger at later stages and earlier ages. And so that's why we have Sid to talk to all of her friends about breast health. Also, we also know that only about 5% of breast cancers are actually hereditary, actually genetic. So even though, but so a lot of women will say, well, my mom didn't have it, my grandma didn't have it, so I'm safe. And that is not the case at all. We also know that we don't have a lot of science for Black women, which is why we're doing When We Trial. I have on my shirt and doing more research to understand the dynamics of breast cancer for Black women. I had triple negative breast cancer and I didn't really have a family history. My mom had ER positive stage 0, 15 years before I got sick, but Black women are getting triple negative breast cancer, the worst one, at 3 times the rate of white women. And we don't really know why. And we believe there's probably some kind of scientific reason that we just haven't uncovered yet. So we just want more families to talk about health. And we also know, I keep saying also, Black families don't talk about health at the kitchen table. So that's why I'd like to start with you guys and talk to me about how your family talks about health. Like Sid, when was the first time you talked to your mom about breast cancer?
Honestly, I would say the first time I talked to my mom about breast cancer was when I started this internship and was posting on social media and just learning more about myself, about breast cancer for myself. Then I would go and share it with, the people in my house. But besides then, I really can't remember having any conversations about it.
Wow.
Yeah, I know.
I know, right? So, and Tamika, you're pretty faithful about getting your mammograms because we've talked about that before, right?
Yes,
So
yes.
you like getting your mammograms and doing all the preventative stuff or, the kind of screening stuff. And so you didn't really know what you were doing, right? So what time, when did you have your first mammo?
40, isn't it 40 when you?
Yeah.
Yes. So from my doctor, basically, that's when leading up to when I was about to turn 40, well, this is the year that you start to have mammograms. Because I didn't have the conversation with my mom. It's just, the doctor told me. So that was never a conversation.
Wow. Yeah, never come. And you know what? You guys are so typical, right? So typical. We have a family that we're dealing with where the mom is 89. She has metastatic colon cancer now. She's never had a colonoscopy in her entire life.
Wow.
She has 2 kids. They're 66 and 64. The older one is and was in the military, so he always got really great health care. So he's had colonoscopies since he was 50 or whatever the rule is, right? And the daughter too, but they never talked about it with their mom. They never, and their mom had good health insurance. She worked for the DC government for her whole career, and so, but they never talked about it. So they
Right.
never knew that she didn't have one, and now she's dying.
Wow.
Right? So but I mean, I keep, my kind of blurb for this is health illiteracy. Our health illiteracy or lack of knowledge about health is leading to all the health inequities that are happening. A lot of
Right.
a lot of stuff that's going wrong because we don't even know what we don't know.
Right.
Right?
True.
So grandma, when did you, I don't
Yes.
want mom, because when did you have your first mammogram?
I guess at the age they really started, maybe 50. And it was because my doctor said it's time to start mammograms. And I get them, appointments every, whenever it's time. They notify me it's time for your mammogram and I go get it done. But like most people, my mom didn't talk to me about it, probably didn't know much about it. I didn't talk to Tamika about it, and she hadn't talked to Cindy, so Cindy has to break that cycle.
Mm-hmm.
Right. But you guys are typical. You know what I mean? We just don't talk about it. If you think about it, what health issues do you talk about with your family? Who has high blood pressure and diabetes and all these things that Black people get, right?
Right.
Who talks about it? We talk about it when Uncle, Sid gets his leg amputated, or Grandma Edith is in hospice, right? So, these are the conversations that we're not having are killing us. It's really crazy, right?
It is.
All right. So how about you, Miss Melissa?
My mother was diagnosed about 30 years ago with breast cancer. She's about 80 now. Luckily for her, they caught it early and she didn't have to have chemotherapy or radiation or anything like that. But it kind of came, I guess, out of the blue because she didn't have a family history. We talked about it more back when she was diagnosed, and there's been so many episodes of illness between my mom and my dad, and we spent a lot of time in hospitals, so we do have conversations about the different illnesses in the family. Like my dad's side of the family has diabetes, and I have it now. I'm a newly diagnosed diabetic, and I had gestational diabetes, so we do have to have that conversation. But my mother was diagnosed about 30 years ago. And at the time, they were putting women on hormone replacement therapy. And as soon as she was diagnosed with a lump, because she had a mastectomy on her right breast with cancer, they immediately took her off the hormone replacement therapy. And so we don't know for sure, but I'm thinking that maybe if she wasn't having that treatment, that maybe she wouldn't have got the cancer, because I think after that, they studied it a little bit more and found out that the hormone replacement therapies were giving women cancer.
Yeah. We don't want to add more hormones to our body because it definitely feeds cancer.
Yeah, it's too bad that they didn't know that then.
Yeah. So your mom was probably about 50 then too, like 30 years ago.
Well, more like 60.
60, which is
Yeah.
still young for breast cancer. White women get breast cancer like in their late 60s and 70s. We're getting it way, way earlier. So that still kind of counts as young. And, so have you done anything, have made any precautions for yourself? When did you start getting mammograms?
Well, what they told me was, since she was diagnosed, they wanted me to get one at 35 instead of 40. So I got a one at 35 as a baseline. And then I continued on after that to get the one every year from 40 on. So I have one younger, and I've had different little issues with my breast, but not anything cancerous. I've
Okay.
had like a biopsy here and there.
Okay. So just be careful, but at least you are aware of your risks and you can, you're taking care of that, which is really, really good, really good. That's really all we can do. You can't prevent it. You can't prevent breast cancer, but you can, know your risks and early detect it. So that's the best thing we can do for ourselves.
I kind of thought that by going get the mammogram every year, that is a form of prevention.
Well, I guess you could sort of call it that, and some people do, but what that's going to show is whether you have cancer or not. It's not going to prevent it. So, for example, colon cancer is preventable because when you get a colonoscopy, if you have a polyp, which could produce cancer, they take it out.
Mhm.
So for breast cancer, there's really nothing you can get rid of. Do you know what I'm saying? Like you can't really prevent the disease from happening. So the frequency of your mammogram is basically just to look for it,
Mhm.
but you can't
Um,
prevent it, unfortunately. And even, the other cancer that, somewhat preventable is a PSA, can't for prostate cancer. But that's also just an indication of a test. So it's really colon cancer. You can go, when you have the colonoscopy, if they find a precancerous polyp, they'll cut it out and you won't get cancer, hopefully.
mm,
For
Right.
breast is going to happen and we just have to hope that we catch it early. And frankly, if you do catch it before stage 2, like up to stage 2, it's curable. It's
yeah,
curable.
I think,
But
yeah, that's what prevention does. I mean, mammograms usually try to catch it early.
yeah, catch it early. And then if you do, then it's curable. It's
Mm.
that, but we're just not catching it. So a question for you guys. Did you stay regular with your mammograms during COVID?
Mhm. I think mine got pushed back, maybe 6 months.
Yeah, the clinic closed or something,
Yeah,
right?
yes. So I wasn't that far off schedule.
Okay.
And I'm just actually recovering from COVID. I got it for the first time, and I'm a teacher, so I'm off during the summer. So my mammograms are usually in the summer. So I've kind of had to put it off until I'm negative.
Okay. And until you're negative. Yeah, for sure.
Yeah, it's because I don't want to go in, and they don't want you in the
Right, they won't
hospital
come in
with
there. Yeah.
with that. So yeah, it kind of does affect, especially if you get diagnosed with COVID. So I'm put it off until I feel like I'm clear.
Yeah. I hope you're okay with COVID. I'm so sick of COVID, right?
Yes. Right.
I mean, I'm more afraid of the monkeypox now.
Oh my God.
I mean, it's getting to spread, starting to spread in Texas
Mm.
a lot.
Yeah, from what I hear, spreading everywhere.
Mm.
Yeah. So I mean, more afraid of that than anything.
I may lose
But-
you. Maybe like lose you a little bit.
What was that?
I didn't hear your last statement. You hear us, Ricky?
You got
Uh,
Did you hear?
okay. Also, Melissa, you might want to mention the fact that you are in that trial. I know, you are.
Can you
doing
hear
a
me now if
total-
I turn off my video?
Yes.
Yes.
I can't really hear you guys. So
Okay.
so talk about how you think can you hear me?
A little bit. It's a little low.
I'm gonna come out.
Mm. Why you put that up there?
Did we lose her?
I don't think all the way.
that her children, Tamika, or grandchildren?
grandchildren.
Okay.
Okay.
But Grammy, when you were like younger, because I know we're saying we don't have much conversations around like health at all, like
Mhm.
just with your generation and like from your mother and everything, was breast cancer ever a topic, coming up?
Never was a topic. The only thing I can recall, my mother had her ovaries. No, she didn't have her ovaries removed, but she had a hysterectomy, but she kept her ovaries. So I can remember that being talked about. But we never talked about breast at all.
Mm,
And later in the years, she developed Parkinson. So that's kind of obvious. You can't ignore that because of all the different symptoms.
right.
But breast cancer, I tell you what I think helps me is that my primary care physician we have something that's called My Chart, where I can go online and get into my medical records, see all my test results, any upcoming tests I need to have. And that really helps because you have a tendency, especially with tests you don't do often, to
Mhm.
forget about it. So having that is a real help for me because I can just go in anytime and look at all my tests I've taken, the results of them, my history, the summary of any times that I've gone to the doctor.
Mhm.
So, and like I said, any tests that you need that are coming up, it'll tell you when it's due.
Yeah. As a
So
matter
that
of
really
fact, I just got a notification that it's time for me to schedule my mammogram in August. It'll be like a year. So,
Now, my mother, we talked about it at the time when she was diagnosed, but she doesn't like to talk about the actual experience because it was not a positive one for her. So she's, we ask her, she'll talk briefly, but after that, she doesn't want to talk about it because, she doesn't like it was a negative experience for her losing one of her breasts, and she's just not open to discussing it.
Mm.
Okay.
I think your mom, I
mean,
think your mom is pretty typical, and I'm not sure why. Why do you think we do that? And um, um, my sound went to my earpods, you guys, I'm so crazy. But sorry, I'm like, wait a minute, I can hear them faintly. Do you know if your mom had genetic testing, Melissa?
no,
Probably not 30 years ago,
No, she didn't have anything genetic. Like I said, I just made sure, since I'm her oldest, that I went and had a baseline mammogram at 35. But as I said before, having a breast removed was really hard for her,
Traumatic, yeah.
traumatic for her, and for us, we were like scared to death. We were like cancer. But she doesn't like to talk about, that experience for her. I do know that she's gone to her surgeon like at first every 6 months for the first maybe 10 years, and now she went to her surgeon every year for him to examine. He did her breast exams after she was diagnosed. But like Tamika was saying, um, I had a girlfriend that went to a good girlfriend too. It was four of us, and we all went to college together, and we grew up together. And she was diagnosed in her 40s, maybe 45 or something like that. And she passed away from the disease. And
Wow.
to be a witness to all her suffering, and I mean, in the end stages, having to say goodbye to her. I mean, it was just hard for all of us. It was really, it destroyed all of us just to see her go through that, and to talk to her on the phone about her chemotherapy, her hair lossage, what is it? Reconstructive surgery.
Reconstruction surgery.
And so she was diagnosed, and I was like, after she died, I was like, I got to do more than just walk in a race or something like that, because it just had that kind of an impact on me. And so I guess God must have heard me, because maybe within a year or so, they were going all around the country looking for participants for a breast cancer study. So I signed up for it, and I went to this place where they took I guess blood samples.
Mhm.
And for the last 20 years, I've been in a study.
Good.
And
That's so good. So
and
good.
what they do is they send me this long survey questionnaire, like every 3 to 5 years. And I answer all of these questions about my lifestyle, my eating habits, my exercise habits, it's really in depth, and it's really specific, because it takes me a while to sit down and
fill it
actually
out.
go
Yeah.
through it. And every now and then the investigators will send me a newsletter telling me how it's helping. And so I've been in it for about, like I said, yeah, about 18, 20 years, something like that. And I just did a questionnaire maybe about last year. And it's interesting how I guess I'm changing. For a long time, the answer to the question stayed the same. But now, since, I guess, menopause, after menopause, something like that, I've been diagnosed with diabetes. That's a change, because once they find out that you're diagnosed with something, then you have to come in and answer these other questions related to your new
Right.
diagnosis.
Right.
And yeah, and so and then they had to add questions about COVID in there,
Right. Right.
because that's something new that everybody has been going through.
Mm.
So, and I'd be open to, it's with the American Cancer Society. So, and they probably have other studies going on at the same time. I think people just don't know that they can enroll in studies, or as Black people, maybe we're reluctant to do stuff like that.
Yeah.
Yes.
Yeah, no, that's so great that you're in this study, and it sounds like a lifestyle study. And I think I'm familiar with the one that you're talking about, but it's great to track trends for women. Like, I'm in a study too, actually, that tracks the stress as a breast cancer survivor. And
Mhm.
so there's a lot of studies that aren't relative to drugs. It's about lifestyle and how you take care of yourself and your life habits. So to me, right now, we just don't have enough data about Black women. The
Mhm.
more we get in any capacity is really important if we can participate in the trial. So, we started our When We Trial movement at the end of January. And we basically are trying to talk to women of all ages, especially people like Sydney and her friends that haven't had a cancer experience, right? To
Mhm.
understand the importance of a clinical trial. And so thank you for talking about that and sharing with it, because I think so many people are afraid of those words, clinical trial. It sounds like and we keep hearing from breasties that, oh, you're going to get the sugar pill and die. Well, there's all kinds of research. And in cancer research, there is no sugar pill. You're going to get protected. But just to understand our behavior and the stress in your life, and how you the food that you eat and the exercise that you do or not do, all those things play a role in how your cancer will pan out. Hopefully you'll never get it, right? But
Yeah.
no, I think it's important for us to participate. So we actually, as of last Friday, we've signed up 1,537 Black women to the clinical trial portal,
Awesome.
which is pretty cool. So that's why I'm on the road today, right, doing it again. But we do have 5 portals on our whenwetrial.org website. and they are breast cancer related trials, but there's 5 portals on the site. If you go to whenwetrial.org, and I'll put that in the comments, you can find information about any trial related to breast cancer, whether it's about a drug or not. And so, and if you want to participate in a trial, we're happy to find you one. And I'll put my email in the comments as well. Email me and we'll figure out how to find so that we can prevent this stuff. So thank you for sharing that, because it's so important and so great that you're doing it.
Yes.
Well, most of the people, when I went to sign up for it, most of the people that were signing up were white women.
Yeah, that's what's happening. You know, we participate at a 3% rate. And so that's why we're doing what we're doing, because we have to get more Black women. And you know, there's this growing body of data now validating that a Black breast cancer cell scientifically looks different from a white one.
Hmm.
And so that's why we're dying in these numbers, and to a lot of extent because the drugs aren't working as well as they could be, because they weren't tested on our bodies. So the more we can learn about Black women and Black bodies and Black science, we have to. We have a question actually from the comments from Cassandra. I'll try to say her name. You know, ask your doctor about estriol. You know, we don't recommend hormonal supplements. I mean, you know, for obvious reasons, but I think you should have a conversation with your doctor about it. She's asking about a drug that she's taking for menopause.
No.
You know, and I think that everybody should have, you know, we can't give medical advice, but I would go back and ask your doctor that question and see what the doctor says about it and see if there's other things you can do. I know we know the hot flashes suck, but cancer is worse. Right?
Yes.
It's a lot worse, a lot worse.
I'm
So,
wondering if too that's part of this whole trend with the whole motherhood mortality thing, where a lot of our women are being discriminated against and not getting the same treatment as our white women counterparts.
yeah, you know, it's all in there. It's all fair game, Melissa. If you think about anything, even diabetes, you know, I mean, heart disease, really high blood pressure, any of the drugs that we're taking for all of these diseases have not been tested on Black bodies. And the birth thing is just, I think that's really just not getting the level of care that we deserve. And you know, we keep saying the words health equity. There is no health equity, it's health inequity.
Yeah.
And to me, we're not going to get health equity until every healthcare provider, doctors, nurses, whoever, even insurance payers, until people practice the golden rule, the rule that you guys all taught taught Sydney when she was 2 years old. Treat people as they want to be treated, as you want to be treated, right? And until the doctor says, okay, this is a treatment I would give to my mom or my grandma or my auntie or my daughter, then it's not good enough, right? And I think, you know, we challenge our patients all the time. And when they say, okay, what do you think about this treatment? Well, go back and ask the doctor if that's what they'd recommend for their mama or their daughter, right? Until we get that level of care and concern and compassion, we're going to have health inequity. Because also there's so many things that we're learning in our roadshow, that so many things that Black people just don't know. We don't know what questions to ask. We just don't know what we don't know. So it boils down to just being a good person.
And then a friend of mine that's a labor and delivery nurse, she's saying that there's just not enough Black medical people in the field to advocate for us.
There aren't. I think the number is 6% of oncologists are Black. I don't know about the fertility area but I mean, we don't have enough Black doctors, you know, which is also why we do our internship program, encouraging, you know, young women to go to medical school or go into the health field in some capacity, because we need more of us out there. But we also need to know, like, if you think about what we're not talking about at home with our moms, right? What are we not talking about in the doctor's office?
Yeah.
You know, are we asking the doctors questions? Are we challenging them? Because I think in a lot of cases we feel like, oh, the doctor knows everything. Well, they don't. They're only human, and they may not have had a lot of Black patients, and frankly, we need to challenge them and say, hold on, wait a minute, take your hand off that doorknob. I'm not done yet. And be able to
Mhm.
stand up for ourselves and say, I have this problem, or I want to talk about this more. Give me an example of when you recommended this treatment for a Black person. And
Mhm.
even Melissa, with your diabetes, I guess metformin is a drug of choice, right, for all people. But if you go back and look in history, I would be shocked if there were Black people in the metformin clinical trial.
And
And
metformin did not work for me. And I called my doctor about it because it was giving me a lot of stomach pain. She took me off immediately and put me on something else. Another thing is a lot of times the drugs aren't affordable. I mean, I have insurance, but it has to be a
right,
drug that the insurance will cover because the insurance company is coming into play a lot as far as care. You
Mhm.
right,
know,
they
they
are, they
tell you
really are,
what you
they
can
really
take
are.
and what you can't take and what they're going to pay for and what they're not going to pay for and all that business. All of that is part of it.
Mhm.
And like my friend I go back to what she said. She's like, these white doctors don't want to deal with these Black patients. These white nurses don't want to deal with these Black patients.
I know
Wow.
you think about it, and in this day and age, right? So,
Yeah, in this day
I
and
don't know,
age.
it's a lot. In
Yeah,
this
it
day and
is.
age, it's still going on, right? It's still going on. But so you guys, how can we help other families talk about disease? Like, all right, so Sid, you talked about breast health with your mom after after I harassed you, right? Right. I said, go talk to your mom right now and make a video, right?
Mhm.
So so like, how do we do that better? How do we make these conversations happen? And since you did that, have you changed how you talk about other things about health within your family? Has it changed you at all, or changed how you guys think about stuff?
Mhm.
I'll start with Grandma. Let Grandma answer that question.
Well, it has changed me because I'm at the point in time in my life and going through issues. I don't have no problem discussing it. Like some people are so secretive about illnesses. I'm not. I'll tell anybody who listens.
Good.
And
Yeah.
it's important if you can do that and not try to be so secretive and worrying about who knows your business. And that's a big problem with Black people.
Yeah.
Hey,
Mental health too. They
right,
don't
Mental
like to
right.
health
talk
too,
about
right?
that.
Stigma.
Yeah.
That's another stigma. Mental health.
Mhm.
Hmm.
But
Sure.
I'm glad I've gotten to the point in my life. If anything goes on, my daughter can tell you I have to go to the doctor. When time I get back home, I call. The doctor said this, that, and that.
Yes.
So
I need a full report.
full report.
Yeah. And
Yeah.
I'm sure you're calling her saying, well, you're waiting for that call too,
Yes, exactly.
Tanika, right?
Yes, yes. I was thinking about something too. Like when I was in elementary school, I remember, I don't know, third or fourth grade or so, like all the girls would go to this room and watch this video about menstruation.
Mhm.
So I don't know if that's too early to have that conversation, but couldn't they like include that? Or do they even do that anymore? Or is that like a thing?
It's
Back,
still a thing.
it's still a thing? Okay.
Mhm.
At least at that
I
point,
will-
to make them aware that when because at that point you're starting to get boobs and,
Health,
yeah,
health.
to talk about it. So they're at least aware.
Yeah, I think, me, like, I think never is too early enough. I mean, I've had conversations with Belle about it. My granddaughter, she'll be 5 next week. But a few months ago, we were in the shower and she said, my grandma name is Debbie. She said, so Debbie, how come you don't have those things on your boobs that baby heart sucks on? Because her mom is breastfeeding her baby sister. And she's probably seen me naked her whole life, but whatever, we're always in the water. But she realized that I didn't have nipples. And so I at 4, I told her everything. I told her about my breast cancer. I explained everything to her. I showed her pictures and now, she'll bring it up. Well, she went to school, told the whole class, told the teacher about it, whatever they are, but I think that it's important to have whatever age whatever they can digest. I think the same thing about sex, but we do need to know about breast health. And we're all, all the schools, even if when they talk about, menstruation, they also talk about, there's also a health class in high school, everybody has to take it. So
Yes.
what are they teaching? What are they teaching in health class? They're teaching you to eat broccoli. So tell people why, right? So I think the whole curriculum about how we talk about, cancer and clinical trials and just the science of medicine. There's things that we all sort of take away from that high school biology class. But
Right.
these are things that are like, it's almost like life skills. They also don't teach you how to manage a bank account in high school. Right?
Yeah.
So it's like, what are the life skills we need to know? And what are the conversations we need to be having with our families? So that we can initiate, at a young age, even
I-
the whole clinical trial thing, you need to wait till you're sick to know what that is, to understand it.
I'm at the
That's too
high
late.
school level. I teach seniors in high school, and I think basically what their focus is sexual health, like,
Mhm.
sexually transmitted diseases, drugs, what can happen to you, how to protect yourself with, girls and boys, how to protect yourself. And anytime I try to talk to my son about certain things, they talk about sexual predators, stuff like that, that they think that that's where the high school student is and the things that they need to know at that age. They
Right.
don't really get into, like, the medical aspect of things.
Yeah.
I guess in certain parts for the doctors, I feel like, we rely on their expertise because we don't know sometimes the questions to ask
Mhm.
with the
Right.
with the
We don't, yeah,
doctors.
we don't know, we don't know what we don't know. We don't know, we
Yeah,
don't know. And I guess the priority at that age of high schoolers, sure, is to talk about sexually transmitted diseases and all of those things.
drugs.
But I wonder, drugs, I wonder in the scheme of things, yeah, because again, those are diseases you can prevent by doing the right thing, right? Um,
Mhm.
but I wonder in the scheme of things, how many people die from breast cancer versus HIV versus, I think and maybe those are some of the things we should even be talking about with kids, that
Mhm.
your risk of getting cancer is XYZ relative even to getting HIV, or here's a disease you can control by practicing safe sex, or here's one where you can't, where you still need to be talking about it with your family, know your risk. So I
Mhm.
think we have to sort of put everything on the table at that age. And, I want to design that class, right?
Yeah.
So Melissa,
Yeah.
help me to just, and that's so actually my daughter was a fourth grade teacher. She just joined us at Touch to be our program development director. And I have her now. She has such a different kind of brand about teaching people. And that's what we do a lot of. And so we're trying to put on, work together to figure out what does this teaching tool look like for women and at what age, right? So we may call you, Melissa, and say, can you help us with this for, for high school seniors, right? Because
Yeah.
I don't know. I mean, that's definitely not my strength, but I think we have to figure out at what age is it right and what do people need to know. And like, if you think about Sid, when we intervened in your life and said, okay, talk to your mom about breast health, was that too late? Was that too early?
Right.
And like, and you did, like, talk about the impact you've had on your peers a little bit from your internship.
Right. I feel like something I always say, because it just is what it is. Like, I feel the conversation doesn't happen until it's too late, or you don't know if it doesn't affect you. And I feel like people don't want to talk about things that don't affect them. Maybe one, because they don't feel educated enough to, or just because out of sight, out of mind. But that's the issue with it. It needs to be brought up. But just since starting with the internship and everything, it definitely started with conversations in my house, but then I would have friends who would swipe up on my story or be like, I didn't know this. Or one of my closest friends, there's a history of breast cancer in her family, and she had opened up to me about that and how, like, her mom and her, like, it's definitely something they've had conversations with, and so they're much more open about it. But that's just because it's in they know it runs in their family. But for everyone else who doesn't, it's just conversations that need to be facilitated. I'm glad I've had a part in that, and just sharing what we do now with When We Trial, or just any bit of information that can be shared is just truly important.
And I try to have conversations with my son, be open with him about it. So maybe that can change the way men approach helping their significant others if they're diagnosed later on in life or something like that. So I'm trying, he's 20, and I try to talk to him openly about things like that.
Well,
So,
for
yeah.
me, after, Sydney got involved in the internship and everything, then just kind of opened my eyes to a lot of things that, I really hadn't thought about before. I started tuning into, the Black doctor conversations, and I'm like, okay, I didn't know that. So one thing I'm gonna do different this time for my mammogram in August is the 3D imaging, because I heard you all talk about having dense breasts, and I always decline because my insurance doesn't pay for the 3D. But I'm like, what, maybe I should. I don't know if I have dense breasts or not. I don't know. Maybe it's a conversation that I need to have with my doctor before she send the order over. But I was like, I'm going to pay that extra and have that 3D mammogram.
I know. So Tamika, the secret is if you go to a mammography center that only has 3D, then your insurance has to take it. Has to cover it. So
I didn't know.
Yes. So now go find a facility that only has 3D and you can get it covered.
Oh, wow.
I mean, check with your insurance. Yeah, but that's how you're supposed to get around that rule, because you should not have to pay for it. And, I believe the numbers are Black women are 60% more likely to have dense breasts. And people with dense breasts are 6 times more likely to get breast cancer. So you want to know about that. And, you should definitely ask your doc about that. But you shouldn't have to pay for a 3D mammogram. Just find a place that only has them.
Okay.
And frankly, the 2D mammograms should be ruled out because they really aren't good for anybody. I mean, it's really mammography is the only real screening device that we have. There's actually some stuff being tested now that's better and more like a sonogram, but it's going to be a long time before they're sort of, widely available. But you definitely want to get a 3D. Every Black woman should. So, but just go to a place where that's all they have. And if you need help finding them, email me. We'll help you find one in Atlanta.
Right.
It
Yeah.
definitely exists.
This one. I've been doing the convenient thing. My doctor's
Yeah.
office
Oh yeah.
upstairs, and I walk downstairs, and it's the place where they do the mammograms in Northside.
Yeah. And Northside, yeah, and
Yeah.
Northside, that's why I had my mastectomy at Northside Hospital in the Women's Center there. But you would think that they would be more advanced in terms of claiming to be like a women's health center, that they wouldn't have 3D, which is crazy. So
now I have a breast doctor that I have gone to on a couple of occasions. She's also a surgeon. She's from New Orleans and she practices out here in Houston. And she was coming out of surgery when she was coming to do my procedure. And she looked at me, she was like, you have dense breasts, so you have to, keep more of an eye on, keep your mammograms regular, because she had just come out of surgery for a Black woman. And she told me, she said, the lady didn't do what she advised her to do. So I think that it ended up being to her detriment. So she told me, make sure you go through and do this. So that's another issue with that you have to talk to Black women about. It's like you need to take whatever the doctor says seriously. And
I know,
yeah.
it's so unfortunate that we have to do more work for ourselves, but guess what? We do.
Right.
And we can't put ourselves at risk because the white doctors, I don't say all white doctors aren't good, because many are, but I always challenge them. Okay, well, how'd that work with our, your Black patients? Have you tried that with your Black patients? What's different about it? But there's also the kind of the protocol for surgery right now with breast cancer is, doctors are saying, or the protocol is that a lumpectomy plus radiation is equivalent to a double mastectomy, right? And, you know, and Cindy will tell you, I'm all about cut the boobs off. We don't need them. Get some fake ones. They're, you know, you can, my little fake ones are bigger than the ones that try to kill me. You know, why go through the trauma again, right? Why the emotional trauma of doing it? But the study that made that mandate about lumpectomy was conducted in Sweden.
Hmm.
So how many Black women were in that study, right? And the data shows that we have a 39% higher recurrence rate than white women. So that's why we're fighting to get more science, because that science is not right for us.
Mhm.
And many of these studies are that way, you know?
And even back then, when my mom was first diagnosed, the doctor told her to go ahead and get it off. And now I'm seeing some of my coworkers get this lumpectomy thing with radiation, a few people. And back then, there was no question, no option, you know, you got cancer, you getting a mastectomy, you know, go ahead and get the mastectomy.
Right. Well, yeah. In the old days, they just cut everything out. You were like concave. And I mean, you know, I think the surgery's gotten a little better, but still the whole like breast saving techniques and nipple saving, you know, to me, just the emotional stress of knowing that it possibly could come back. I wanted to get rid of all that, you know, but I mean, it's definitely a personal decision. I wasn't attached to my breast the way that a lot of women are. So everybody has to sort of make their own decision, but you know, we are not our hair, we are not our boobs, we are way
Right.
bigger than that. And you know, to me, it's about saving your life and making sure that you've taken every precaution you can to fight that 39% higher statistic, right?
Yeah.
Right. So, wow. Anybody else want to share anything? You guys are awesome. Thank you so much for having this conversation. So also, Mom, Grandma, how many other kids do you have?
I have 2 kids,
Mhm.
a girl and a boy.
A girl and a boy. So do you talk to your brother, Tamika, about breast?
No.
Is he married? Is he
No.
married?
No, he's single.
Do
No,
you
not
talk to your brother? Do you talk to your brother, Sid? Do you talk to your brother, Sid?
You know, I tried to interview him one time and he was like, what do I have to say? I'm like, because it's just a new perspective. It's just something to know. So I've tried. But
So that's your assignment, Sid and Tamika. Go
Okay.
interview your brothers
Mhm.
and your dad, Sid, and both of your brothers, Tamika and Sid, and send me a video. Like see if you can get you can use my Zoom, see if you can get them all in Zoom to talk about it and see what they say. And Melissa too, if you want to jump into that bandwagon, do you have sisters, brothers, siblings?
I have a
Your brother.
brother and a sister. Yeah, I have a brother and a sister.
Do you talk
And
to them about your mom's cancer, about what you're doing?
no, not too much. You know, I think they might know I'm doing it, but you know, I don't get in. I actually talk more to my friends about it, like Tamika, than what I talk to my family about it. But if something is going on with my sister and she having some breast issues or I having some breast issues, we know about that.
Mhm.
But other than that, you know, we don't talk too much. I talk a lot to my friends.
Okay. What about your diabetes? Do you talk to your siblings about your diabetes?
Yeah, they're, you know, that was a big deal when I got diagnosed with officially with diabetes because I guess she has high blood pressure. But even for me, once I was diagnosed officially, I just started to cry because I knew that, you know, this was something that I was going to have to deal with the rest of my life. And then I had the wrong doctor. I had a man doctor, and, you know, he was trying to put me on all this medicine that wasn't necessary. So I had to change doctors. But it's scary. And it was scary when I had it as gestational diabetes because they started talking to me about how it could affect the baby. And I had to call in my numbers and all kinds of stuff, you know. And, you know, I have my way about it. It's like, I'm not poking myself with no needle every day, you know. And I got the electronic thing, but luckily for me, it's under control with medicine.
Mhm.
But they
Good.
told me back when I had it, during pregnancy, that I had a 60% chance of getting it anyway.
Wow, 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 wow.
Yeah.
Interesting, huh? So you guys, we gotta like, how do we, have these Black men get breast cancer too. Like, so male breast cancer is only 1% of breast cancers, but guess what? Black men have a 66% higher mortality rate
Mm.
than white men. So when they get it, it's probably like a later stage because they ignored it or didn't really know what it was or weren't aware, and they're dying. So, and again, here we go with the medicine. I'm sure there's not been a Black man in a breast cancer medication clinical trial, right? And I'm sure it's not happening now, right? So but it's really just all these diseases. Like, my family, I drove them crazy. Like on Thanksgiving, I make everybody before they eat the food, because I'm a cook, go around the circle and say what you're thankful for, but also say, guess what? What's your PSA? What's your A1C? What's your blood pressure? They hate me, I don't care. Now it's like, okay, Ricky, shut up, and so we built our family tree, and I've put everybody's diseases that I can find in the family tree. So we can see, and actually the government, HHS, actually has a family tree format on their website where you can make a health family tree. So I can tell you
Good idea.
pretty much. I've got my grandparents down. I've got two of my great grandparents down that my mother could remember stuff because they had diabetes. But we're trying to build that now for our kids. So when I show my kids our family tree, my grandkids, I could say, well, you know what? That grandma had breast cancer. And it really wasn't until I was sick that my mom remembered that her aunt died of breast cancer at age 42. So she probably had triple negative, but we didn't have a name for it back then, or they didn't talk about it, right?
Right.
So, and even my dad died of colon cancer at 73, which is way too young, because I don't know, and I never talked to him. I don't know whether he had a colonoscopy or what, right? And
Yeah.
because he didn't want the family to know, he didn't do chemo deliberately because he didn't want to be a burden to the family, that whole Black man take care of everybody syndrome like we have as Black women. So, but we have to get over all these crazy
Stereotypes.
right?
Yeah.
Stereotypes, and also put it on the table. Like, I don't know. I have a bunch of Jewish friends and they talk about everything. Everybody's complaining about whatever they have, and then and it's a conversation in the household.
Right.
But we have to bring these conversations. So thank you so much for doing this today. And but I'm gonna hold you to it, Sid. That's your intern project.
Yes,
to get
sorry.
all these men.
Mm-hmm.
I think, Sydney, you should be in charge to Christmas. Christmas is usually
Yeah.
your house. Yeah. So you're in charge of building that health tree.
Okay.
Us, our family.
All right.
Yeah. I'll help you, Sid. I'll help you. I'll show you the format thing, Yeah, that's a good intern project for her to do, right?
Yeah.
And you know what? And think about all the other people you can influence. Like, look at your circle of women and think about it. Within your circle of women, 1 in 8 are going to get breast cancer. If you're younger, there's more odds against it, right? And then so think about in that circle of women that you are in, and we all have our little matriarchal circles. Think about who you can talk to today or tomorrow or next week or the next time you go hanging out with them or next time you go to the hairdresser. I mean, we all have to have these conversations and get over the fact that we're talking about boobs. Who cares? We're talking
And
about life.
also, Ricky, let me know or email me and let me know how to go about maybe bringing that up in the academic, I guess, the academic setting.
Yeah, we're
I
talking
have
about
a
that.
platform, and sometimes I can incorporate, I'm an English teacher, I can incorporate things into the lesson. Even if, it's not going to be per se part of the curriculum, but I can give articles, stuff like that for them to read.
Great.
And then
Great.
to go in and comment, give their input on things, and it can be like a lesson for them,
Great, great,
you
great, great.
know,
That's awesome. That's awesome.
but somebody
So,
would have to
Grandma,
write the curriculum for it.
let's work on that. Let's work on that. I'm gonna hold you to that, okay, Melissa? Okay, Grandma, close us out with some words of wisdom.
Best thing I can say, just be aware, try to get as much knowledge as you can. And don't be afraid to share it.
Mm.
The main thing is holding us back is not sharing what's
Mhm.
going on in our lives, our friends' lives. Communication, that's the biggest key. And Melissa, I wanted to say to you to kind of research, because the school systems are so crazy now. They don't want you to discuss this. They don't want you to talk
Yeah.
about this. You can't read this. You just be
Yeah.
careful. Get ready to do it. Make
Yeah,
sure.
yeah, I am. I know kind of how far that, I know how far I can go
Mhm.
to, to what
Mhm.
to bring into the classroom setting.
Yeah.
But yeah,
Good. And
Great,
if
great, great, great.
I wanted to tell Melissa before we stop, I'm a good listener. And if you ever want to share, I'm here to listen.
oh yeah, yeah, that, thank you.
Extension from Tamika. You don't have just Tamika. You can talk with me too.
Yes,
I love it.
thank
I love
you.
it. I love
Yes,
this so
thank
much.
you.
I
I will
love this
take you
so
up
much.
on that.
All right. Anytime.
I love this so much. I love this so much. So you guys, thank you so much for doing this. Thank you, Sid. You know how much I love you. You got to come to my beach, girl.
I do.
All right. So we'll plan that. All right. And we thank Novartis for giving us money from their STEP program to do this program and have more pink table talks. And we want you to be healthy, happy, and terrific. And we love you guys so much. Thank you so much for joining us today.
Thank you for
And-
having us.
all right. All right. Rusty love.
Rusty love.
Rusty love. Be healthy. Take care. Bye.
Bye.
Bye. Bye. Thanks so much.